on Fridays, actually, starting today. But
Yes.
before we get to all of that,
Yeah.
we're going to head into the Zoom room
We sure are.
and we're going to talk with Angie.
Angie,
Tao.
Jamanila, Gumatauta. Let's get all our
Jamanila.
family names in there. I like that name though. Jamanila.
We're
Yeah,
jamming.
man. Yeah, Jamanila, Gumatauta.
So, Angie, thank you so much for joining us this morning.
Yeah, and Angie,
Thank
guys.
you. Thank
bas-
you for having me.
Of
Good
course.
morning, Chris, Bree, and Jason, and Hoffaday Guam, and the KWM family.
Thank you. And Angie, just to give a little background before we get started, basically, guys, Angie caught the vid. She caught the COVID, but she says the monoclonal antibody treatment saved her life. And that's why we wanted to bring you on here, Ange, to share that story with the people of Guam.
Yeah.
Let's start at the beginning.
Let's start with how you were exposed.
Okay, so that's one thing that the few people who knew that I had COVID asked me, like, where did you get it, or how did you get it? And I actually have limited movement. I don't go many places. It's just mainly work and home. And whether I need to go to the grocery store, which I've limited to Kashilas, Happy Mart, and Payless in the last few months. And I don't social gather. I don't go out. Truthfully, I'm unvaccinated. So of course everyone knows the mandate. I'm like not allowed at many places. So it was very limited. I don't know how I caught it. I don't know where I caught it from, but I caught it. I caught the virus, and unfortunately, I had COVID. That was one thing that I was dreading, like throughout the whole pandemic, was I feared catching COVID.
But you took all the steps to protect yourself and protect your family, and yet, as you mentioned, you were still exposed. So, how soon after you tested positive did you decide that I need to get?
What were you feeling after when you went to get tested? Were you feeling something that prompted you to, hey, I need to go get swabbed?
So it was a Saturday. I think like the Thursday before, I've already started to have an onset of symptoms. I couldn't taste, but I thought then that I was probably coming down with the flu because it was also raining that week. I caught in the rain several times, so I thought I was coming down with the flu. Then I started the next day. My eyes were hurting. I started to feel fever and chills. And then that Saturday, I just had everything. Like my body was like everywhere was the body aches, headaches. I took a Tylenol. I was like, man, I'm gonna get tested, but I was like, let me just figure this out, because when I called FHP, they said that the backlog is about 2 to 3 hours. There's a lot of people with COVID symptoms, and so I'll have to wait in the parking lot. So I said, let me take a Tylenol, rest. What prompted me was I couldn't breathe. So I woke up and I called my husband immediately, and I told him that he was at work. So I called him and I told him that I was having a hard time breathing and I think I have COVID symptoms. I need to call the ambulance, right? So we checked my oxygen. It was around 92, 93. And, Dr. Jolene again and all the other healthcare professionals were advocating if it was below 95 to seek medical attention. So the medics picked me up, and then my hospital choice was GRMC. So when I got there, I was well taken care of immediately. And they ran some tests, they ran some x-ray, they ran EKG, and then they swabbed me. And then a few hours later, it came back and the doctor's like, I have some news for you. So I was like, okay, like, that's good, right? When they have news for you. And then he was like, unfortunately, you have COVID. So he was like, right now, we're going to just give you the referral to get the regencov. Go home, and if you still feel like you can't breathe or your oxygen is below 90, come back and we'll admit you. I was like, okay. So I inquired the next day, but the regencov treatment does not operate on Sundays. So I had to wait till Monday. Sunday was like the worst. It was like the flu times 1 million plus like everything like you don't ever want to possibly feel. And it was hard because it was like, do I go to the hospital? Do I fight it at home or what? So I just continued to pray until Monday morning. So I called on Monday morning. I called my primary doctor and he said, yes, you're going to get the regencov. Just go ahead and do whatever GRMC said. So I called Dr. Lewis Cruz and he was like, oh, can you come now? Like, come right now. I was like, well, I can't drive. I'm really weak. I'm very sick. And he was like, you can have someone come drive you. So he gave me the instructions of what I need to do when I get there. So I did. I got the regencov. And do you want me to tell you the process?
Yeah.
Okay, so when you pull up, there's the guard right there where the night market. So you're gonna pull up, you're gonna let the guard know that you're gonna get the regencov. You're gonna show them whatever paperwork. Then you're gonna drive outside of the Miguel Senior Center. The windows are open, so then there'll be a nurse or a worker that would come out, and then they'll assess you. They'll take your oxygen. They'll ask you all these medical questions, your information, and then they'll tell you to remain in the vehicle. They'll go inside, prep your paperwork, and then they'll come outside and get you. You walk in, you sit at a table, and then they'll have you read through the paperwork before you sign it. And then they'll ask you if you have any questions. So I had a lot of questions because one, I didn't know anybody who got the regencov.
Yeah.
And then two, I wasn't certain about it because it was only EUA, right? Emergency Use Authorization. And I've never heard of regencov ever. Aside from getting the pamphlet from GRC and reading through it, I wanted answers verbally. So I asked, I was like, does it really work? Is it effective? How soon after I get the regencov will I feel better? I was told a day, sometimes a few days. And I was like, okay, that's all I want. I just want to be better. I don't want to be hospitalized. I don't want to be on a ventilator. And the worst case scenario is I don't want to die.
Yeah.
And then I said, I'm not vaccinated. I read the regencov pamphlet. It said that I can't get vaccinated for 90 days. So they said, yeah, that's correct. Once you get the regencov, you're unvaccinated and you get the regencov, you cannot get vaccinated for 3 months or 90 days. So I was like, okay, I can't get COVID tested because I'm positive for 90 days. I can't get the regencov for 90 days. That sounds like a great idea. Like I work for the government. So, the whole mandate with the government. So I got the regencov. I think everyone's experience of getting it is different. I have a high tolerance for pain. But once they inject it, so you have to cross your hands like this. And then there'll be two nurses. So one would inject on the left and one would inject on the right on this part of the arm at the same time. It has to go in at the same time. So imagine getting 2 shots at one time. And then they go to your stomach. So you have a choice between your arm or your stomach first. I chose my arms first, and then I got it on my stomach. So you get 2 shots again on your stomach at the same time.
For a total of 4 shots?
4 shots.
Oh, wow.
And it was like, it didn't hurt, but it stung like so bad. Like it was just like maybe 10 bee stings at one time. And then they put you in this area behind where you got the shot. They put you in this area. And so there's maybe about, I'd say 9 to 12 tables. And so it's 1 patient per table. So everyone sitting in that area is all COVID positive and they all just got the regencov. But there's a 1 hour observation. So I'm sitting at a table. There's probably 8 people there at the same time as me who got the regencov. So you sit there and you wait for observation for 1 hour. I was like really out of it. I was just like, I just want to go home and lay down. I'm not feeling well. But the thing that kind of gave me like anxiety was the clips that are showing on the TV were all the video clips that they make for COVID, like the hospitalizations, getting vaccinated, getting tested. And I'm sitting there in front of the TV. I have COVID. I just got the regencov, and that's not something I want to be watching. Like people being hospitalized, people who've recovered and battled, who are on a ventilator, who are in ICU. I wanted to just like block it out and say, or I wanted to say like, man, is there something else you can play? This is not something.
What was it on it was on the Adaloop channel or something?
No, there's a TV in front of like where the holding area, the observation area. There's a TV playing, and it's different video clips that like Dr. Jolene Uggin,
Yeah, so the videos
Dr.
that
Mike
they make.
Cruz. So they're playing all their COVID clips while you're waiting for in observation. So that was something like I just thought wasn't like, it wasn't appropriate. Like you're sitting there and then you're watching a clip of like someone who recovered from COVID, who was on a ventilator, who was in ICU. And I'm just like, you don't want, right? You don't want to watch that while you're battling COVID. So yeah, I got the regencov, and the next day I felt worse. And if you read the pamphlet for the regencov, a lot of the side effects actually is similar to COVID symptoms. So when I got worse the next day, I was like, is it a side effect, or is it my COVID? You know, the COVID's getting worse for me. What is it? So I just like kept thinking, okay, keep doubling up on my vitamin C, my zinc, my vitamin D, just constantly take Tylenol, and, you know, drink a lot of orange juice and eat a lot of oranges. They did call maybe 2 days after to ask how I'm doing. I said, oh, I'm not doing well. I feel like I'm worse. When is this going to kick in? Am I going to get better today? Am I going to get better in a few days? Am I even going to get better? And they're like, okay, we'll note down and we'll let Dr. Cruz know. And, you know, if anything, you'll need to call 911 and, you know, go to the hospital. I was like, okay. So maybe 3 days after I got the regencov, I felt like I couldn't breathe again. I felt like I was having difficulty breathing. My oxygen was still below 95. So my husband called the medics, and then, you know, they were like, your oxygen's 96. And so that was one thing too, was you can have your oxygen at this, but they said it has to be consecutive, like not just when it's 92, you're going to like rush to the hospital, like monitor it for like a while, like maybe within the hour. And if it's still the same, then you go. Me, I'm just like, oh, it's 92. I have to go to the hospital.
And but you know what they told you in the pamphlet, and I know it was all written down in probably black and white, but did it really prepare you for what you were experiencing after you got the treatment? Because I don't know about you, but from what I hear about this treatment, it kind of sounds like one and done. They stick you and then you're good and you're right back at work the next day.
So that's what happened. Like when they called me and asked me if I was, you know, how am I and all of that. And then they said, give it a few days. So I was like, okay, like when, like what's a few days, right? I want to feel better. I thought this was going to be okay. And then I was like, man, maybe I'm unvaccinated. Maybe it's not effective because I'm unvaccinated. But I wrote it off. I got, you know, I fought it. And then maybe 1 week later, that Monday after I got the regencov, the 4th, October 4th, I started to feel better. I started to feel less of the symptoms of COVID, but I still had like the headaches. I still had the bad cough, difficulty breathing. I don't have my taste and smell back even up to now. But I was like starting to feel like I was getting it back, but then it didn't come back. The one thing about the pamphlet though is, you know, when you see may cause death, that kind of just like throws everybody off. But if you thoroughly read through, I believe it's like 4 pages. If you thoroughly read through it, it's kind of just like taking any other, immunization, any other medication, any other treatment. Like there's all these bad side effects. It just depends on your body. I firmly believe if I didn't get the regencov, I would have probably been on a ventilator, or I probably would have died. Right. I have an underlying health condition. There's no doctor here in Guam that treats my underlying health condition. I have lupus, and there's absolutely no rheumatologist here in Guam. And I can't travel to the Philippines like I normally do every 3 months for medical appointments and treatments and so forth. So I've just been stuck since May last year with telehealth between my primary doctor and my rheumatologist in the Philippines, which is very difficult. So I was just thinking, if I had when I had COVID, if I got severely ill and I was in the hospital, who would really take care of me? Like, would the doctors know how to treat someone with lupus with COVID? You know, they don't really know much about lupus like a rheumatologist does. And I'm unvaccinated, so
Was that one
I
of the
really
reasons why you weren't vaccinated because of your underlying health conditions? Did that kind of prevent you?
okay. So I actually got back on island last year, like maybe a few days to a week before the shutdown. And so I travel every 3 months to the Philippines. So I was supposed to leave in May. Of course, we couldn't because of the pandemic. So since then, I've been on a high dose of steroids prescribed by my local doctor. And so even at that, with the high dose of steroids, you cannot, and certain medications that I take, you cannot get the vaccine. So I wasn't authorized to get the vaccine or approved to get the vaccine by my primary doctor and my rheumatologist because of my medication. I would actually have to stop my medication and then lower down my dosage of steroids to the lowest dose possible, which is 5 milligrams.
Wow.
And
So-
I was actually on 20 since last year in May. So you can't just go from 20 to 5. You have to like gradually decrease your steroids and taper down because it can affect. You can have a flare. It can be more worse if you just go from 20 to 5 or just go from 20 and stop taking steroids, period.
Right.
So I had to taper, and then like I had to stop some medications. Instead of taking 2, I had to take 1. Instead of taking 1, I couldn't take any. And then coincidentally, the Tuesday before I caught COVID, my doctor just gave me the paperwork and said, okay, you can get the vaccine now. You can only get Pfizer, but you cannot get it until the end of October, which he already set dates for me to taper down to the lowest dose possible and get it like October 24th, right? So I was like, okay. And then I said, well, doc, what if I get COVID? He goes, you're going to get COVID. I'm going to get COVID. Everyone's going to get COVID. It's the new flu. You just have to prepare yourself. And when you do get COVID, you need to get the regencov. And I said, okay. And that was a few days before I found out I had COVID.
Wow.
Like, what are the odds, right?
Yeah.
Wow.
Well, this is a really good discussion because, when you first said you were unvaccinated at the beginning of the interview, I didn't know. I thought, okay, you just don't want to take it. I don't know. But there are a lot of people, and I've run into a few of them who just can't take the vaccine, but yet somehow there's this stereotype about the unvaccinated. And I don't know whether or not that's because of the mandates or just the tone of the messaging that comes out from the government about those people who are unvaccinated. So that's really interesting to hear that you were unvaxxed and that you had your own personal medical story that goes along with that. Did you ever try and get a medical exemption so that because I know in the beginning you said as an unvaccinated individual, your kind cannot go to eat at the restaurants or the movie theaters. Did you ever think about getting a medical exemption because of your medical condition?
So I actually asked my doctor the week before, because the government mandated if you're a government employee, it was mandatory COVID testing or vaccination on the 27th, right? So I did ask my doctor the week before, and I actually even told him, I said, they want to know like why I can't get vaccinated, what's my diagnosis, and then they were saying they can't give out detailed information. They can give limited information on the doctor's note, but they cannot give like everything because of the HIPAA. And then I was like, okay, so I'll take whatever. And then the process to actually apply, I've actually just heard from someone the other day that out of everyone who's applied for medical exemption, they only know of one that was approved medically. And that was one thing was I was already preparing all my documents, my paperwork. I was even thinking like do I resign because of this? Do I, I had so many thoughts to my head. I even asked our COVID response officer with the mayor's council. I was asking her like, okay, so if I test Monday and I don't get my results back to till Thursday, what happens? And she's like, you can't go to work till you get your negative COVID results. And I was like, that's just great. So what happens the following week if I go again? And then she was like, that's just how it is. And I was like, oh my God, it's really stressing. It puts a lot. And they should honor, like, even if it's a doctor's note saying patient cannot get vaccinated due to whatever, they should honor it. They shouldn't ask like, what's the diagnosis? What's the medical condition? Because honestly, that is against the HIPAA law. And it's actually, that document does not just go to one person. It goes into the hands of many people. And we all know how Guam is, right?
Oh boy, do we. Do we really know how Guam is?
And then KWM might get a copy of that and say, hey, Angie's not vaccinated because she has this medical condition.
But you're really exposing a lot of the glaring discrepancies and inconsistencies with the governor's mandate that targets the unvaccinated. And I've heard the same thing. It's like it's almost like they're trying to just force everyone, I mean, they are, to get vaccinated, right? I mean, you couldn't even get a medical exemption. And public health, they quit giving out the exemptions. They made it so difficult to even get one. And when you hear that they've only approved one, to me, it's almost disingenuous.
True. And like I said, like, what does it take for like your primary doctor to call public health or what? And my doctor, like, I don't want to mention his name, but he's like one of the best doctors on island. He's very close to the governor. So when I was telling him, he was like, oh man, just get the document and submit it. And I said, yeah, doc, but if it takes you to call the governor, can you do it? And he started to laugh.
That's what it takes nowadays. Got to be in, I guess. But then what you had also said about having to get the weekly negative test, I mean, to be told that's just the way it is, that if public health is going to sit on their hands and take 4 days to give someone a positive result or their test results, which we've heard of too many times during this pandemic. That's what you're told is that's just the way it is, that you got to miss 4 days of work because public health can't get their stuff straight.
Correct. And you know what? Also, one of the questions too, Bree was telling me that I was going to answer was, yeah, public health didn't call me. I mean, I appreciate all their efforts and the hard work that isolation, quarantine, contact tracing teams have done, but I wasn't expecting a call like it was last year on the second wave. Like it happened right away when people I knew had COVID. But this time I didn't get a call till about 5 days after I tested positive. I finally got a call. And they were doing everything through Sarah Alert now. So she was like, do you want text message or do you want email? And I was like, what happened to like someone physically calling me every day, asking me, do I have symptoms? How am I doing? Do I need anything? She was like, oh, because of the high rise in COVID cases, there's just so many. They don't have enough staff and people to help assist. So I said, okay, I'll do the Sarah Alert. So I got the Sarah Alert and it was I just find it kind of like inaccurate because on the Sarah Alert, it'll give you all these symptoms. And then at the bottom, it says no symptoms. So can you imagine if I put no symptoms and I have symptoms, they're going to clear me. Like they're going to clear you from isolation. So you have to I just want people to know if you have symptoms, please answer that to the best of your knowledge. Like, don't just say, I'm tired of being in isolation. I'm going to put, I don't have symptoms so I can get released. Because that's how community spread happens is people don't want to be isolated. They don't want to be quarantined. They don't want to be, but you put other people's lives and health and the community at risk by doing that.
But Angie, I don't want to let public health off the hook because their delayed response in contacting these positive cases, that's also jeopardizing people's lives because we're hearing, I mean, we have Dr. Ho on all the time. When you read about these DOAs, some of them are known positives. And that means if they were a known positive, public health knew that they took a test, that they popped positive for COVID. And what we're hearing from you is that they took 5 days to contact you. And then they throw up this Sarah Alert app, which I'm pretty sure a lot of these dead on arrivals don't have because they're poor. Right? So that's very frustrating to hear about these gaps. And it's even more frustrating because when we take it to public health and we say, hey, people
I
like,
just wanted I wanted to rest. I wanted to rest, recover, and heal. And I didn't want to be put under. I didn't want to have anxiety of like people asking like, "What are your symptoms?" Or, how did you get it? So I just kept it very bare minimal. But I did have someone reach out to me, and she told me that they didn't call her until like her 14th day, and I was like, "What?" She goes, "Yeah, they never called me until like 14. Like her symptoms were already gone when they called her."
wow.
So that was just it was very very heartbreaking to hear that. But I know on their end they're doing as much as they can and they don't get enough credit for it, but they're understaffed. They went from a large group of workers during the first and second wave to like a handful now. And maybe public health can reach out to other government agencies to assist, or maybe hire people temporary, or find Department of Labor programs, the AHRD, the CWEB program, the CSEP program, at least just to help support this, because we're never going to get anywhere. Imagine people who are COVID, they don't have symptoms and they don't tell people, and then they're out in public.
Yeah.
That's like that. I feel like, in my opinion, I feel like the asymptomatic ones are the ones that may make it worse for other people who can contract COVID. And honestly, I'm just gonna emphasize on what the governor said. The virus is a bee.
It's a
and
bee.
I told Sabrina that. It really is.
So many great quotes.
It's horrible. It's horrible. I pray like people who get COVID, like they control it and they get the regencov. When I recovered from COVID and I posted on my social media that I beat COVID, I actually had about a dozen people that day reach out to me and ask me, how can I get the regencov? Mm-hmm. Do I qualify? Where can I get it? Who do I call? And I was just like, here's Dr. Cruz's number. Call them. Please don't wait until your symptoms get worse. And one of the qualifications is you have to be like a percentile in obesity. I'm like, this is Guam. Everyone's obese. Right. Like, there's no one here that does not qualify.
Hey, easy, girl. No, but thank you so much. And I just got to go back to what you said when you posted on your social media that you beat COVID, and you just got that avalanche of people saying, where do I go? What do I do? I just want to go back to what we've been saying here on the link, is that the messaging out to the people of Guam about what they can do after they test positive, it needs to be more consistent, and it needs to just be more everywhere, because a lot of people don't even know, and we talk about it all the time, but about the regencov treatment. There was a big to-do when it first started, but there's not that consistent follow-through, so that it really drums into people's head that when you test positive, you can go get the regencov because it could save your life.
And prevent hospitalization.
Hospitalization, yes.
Yeah, it's a key component.
But before, like I highly recommend it. Like, especially those with underlying health conditions or severe symptoms, I highly recommend getting the regencov. But do your research, do your studies. I read up a lot on it on the internet. I read up a lot about it on the pamphlet. I asked questions when I got there. I asked questions to my doctor as well. And please, before you get the regencov, or even before, if you're unvaccinated and you do decide to get vaccinated, consult with your primary physician before, because there's a lot of people in this day and age, they think they're healthy, but you don't know when you're 20, you don't have like the means to go to the doctor all the time, but you may not know that you have an underlying health condition. You maybe you're diabetic now. So before you get the regencov or get vaccinated, please consult with your primary physician. Like, do your research. Don't wait to get it and then you find out that you had a side effect to it or a reaction because you had this or you're allergic to that. But Do your research. Those who are positive, don't wait. Get the regencov as soon as you're able to. If you're eligible to get it right when you're positive. And when you go to the hospital or you go to the T's and testing site or any of the tier 2 clinics, ask them. If they tell you you're positive, say, can I get a referral to the regencov for the regencov treatment? Or how can I get the regencov treatment?
Yeah.
Don't wait, because there is, if you ask Dr. Cruz, there is like a criteria. You cannot get the regencov if they said if you're on oxygen, or if it's below a certain amount,
Yeah.
or if you're already in the hospital.
Yeah.
And yeah, that's one thing you need to do is you need to find out. Don't wait till it's too late.
Yeah, I mean, gosh, Angie, this is a really enlightening conversation, and I just think we got to do better, because if public health is testing you, and public health knows you're positive, and public health is issuing the regencov treatment, then it's almost like how these different government agencies, their computers don't talk to each other. Well, we're talking about the same government agency, and they should just do it. So if you're a positive, it's like, hey, regencov team, we have a positive here, and then they call you and they say, hey, you're positive, we're with regencov, we'll come pick you up, or something like that.
Yeah.
Thank you,
Correct.
Angie. Yeah.
Or I was also thinking like, okay, have an area, secured area, or an available area for people to get tested. And if they're COVID positive, at that same time, you go to like this part of the building and you get the regencov. Like, have it convenient, because a lot of people who have COVID, they're too weak or cannot drive. They have severe symptoms, and they don't want to expose themselves to another loved one who has to transport them to get the treatment.
Angie, we got to let you go, because if I keep going, you're going to keep going, and before you know it, it's going to be noon.
Okay, so yeah, we'll talk more. If you guys have
Yes.
any other questions, or like me to come on again later,
Thank
I'd
you.
be happy to. But I appreciate everything you guys have been doing throughout the pandemic, and for having me on the show. And those who need to hear my side of the story, or want my advice or opinion, feel free to contact me or private message me on any of my social medias. Thank you again, Jason,
Thank
Bree,
you.
and Chris. You guys have a great Friday.
You too. Take
You
care.
too. God bless you.
Bye.
Bye.
All right. Phew, boy. That was a lot.
Yeah.
That was a lot.
I'm
Great.
just glad she's okay.
Yeah, of course. What a great story.
And we actually have known Angie. Like, we've covered a couple events, and she's over at the Agana Heights Mayor's office, and she said she's very, very, very caring. But she goes, yeah, I have a high pain threshold. She's a tough cookie.
Yeah. But again, when you hear these stories, it's funny, some of the little details you hear, like public health didn't call me for 5 days, or public health didn't call my friend for 14 days, or my other friend never got a call at all. It's those little things to me that are really key, because that's been the criticism, is that public health is just overwhelmed.
Overwhelmed.
Yes, they